Let's look at how we can reduce paternal mortality related to postpartum hemorrhage. Let me begin by telling you a story about Moni Akhtar. Moni Akhtar had planned to delivery conducted at home by a traditional birth attendant. She started her labor pains early in the morning, and for several hours the labor did not progress. And that's when her family decided that she needs to be taken to a health facility nearby. Unfortunately for her, the Shiv Pasha Family Welfare Center was not very far from her house. So they decided to go to the Family Welfare Center, where a trained midwife assessed her and determined that she needs to be taken to the district hospital. And at the district hospital, she delivered a healthy baby by cesarean section. But in Bangladesh, many more thousands of Moni Akhtars still deliver at home. They are not fortunate enough to have a functional health facility or a skilled personnel near to their homes. And that leads to a high number of maternal deaths still happening in most parts of Bangladesh. It is estimated that Bangladesh accounts for approximately 7,000 maternal deaths each year. Each of these deaths is a tragic loss to the child, to the family, to the community, and to the country as a whole. Let's look at why these mothers are dying and where they are dying. If you look at the graph, you can see hemorrhage is one of the leading causes of maternal deaths. And when are these mothers dying? Out of the 194 maternal deaths among 100,000 live births, 142 are dying after delivery during the postpartum period. We need to consider PPH as a priority. As I mentioned, hemorrhage is a leading cause of maternal deaths in most parts of the world. And it is preventable through the use of simple interventions. It is also treatable but requires timely recognition and timely care. It is also an unpredictable condition. In the case of Bangladesh, almost 58% of women are still delivering at home, in most cases without the assistance of any skilled personnel. Timely referral and transport to health facilities are often not available or not affordable. Emergency obstetric care is still a distant dream for many mothers who live in remote rural areas. Nearly half of maternal deaths occur within the first 24 hours itself after delivery. And PPH can be a very rapid killer, causing death within such a short period of time as even as little as 2 hours. Anemia can increase the risk of dying from postpartum hemorrhage. It is very difficult to predict postpartum hemorrhage by using risk factors. Therefore, all women should be considered at risk of postpartum hemorrhage, and hemorrhage prevention must be part of every birth. What can we do to address the problem of postpartum hemorrhage? The intervention should begin from the antenatal period itself, starting with early identification and registration of pregnancies, so that antenatal care and counseling can be provided to each and every pregnant woman. Misoprostol has been identified as a breakthrough solution. Misoprostol is a simple medication that can be administered immediately after delivery, which can prevent postpartum hemorrhage. It is a very safe intervention, it is very easy to store, and it is very inexpensive. It is recommended that misoprostol should be used in settings where oxytocin is not available or cannot be safely administered. Another intervention that we should consider is active management of third stage of labor, especially in situations where skilled birth attendants are available to facilitate the delivery. Active management of third stage of labor consists of 3 components. First one is intramuscular injection of oxytocin to be administered within 1 minute after delivery, controlled cord traction, and uterine massage after delivery of placenta. And most importantly, we must ensure that all deliveries are assisted by skilled birth attendants. In the case of normal delivery, we need to make sure that all deliveries are at least conducted by a trained, skilled birth attendant, supported by basic and emergency obstetric care at referral level facilities. We also need to facilitate referral system and emergency transport so that in case of complications, mothers can be immediately transferred to facilities. So a combination of these interventions can prevent up to 50 to 60% of postpartum hemorrhage. In summary, we need to have interventions that can shift care from unskilled providers, mostly happening at home, to skilled providers, mostly at health facilities, as well as at community level. Thank you.